Mike Devlin, and I work at Harvard Pilgrim's Foundation. I want to welcome everyone to this segment on mental and emotional well-being in the pandemic with Dr. Charmain Jackman. The My Members Wellness Employee Resource Group appreciates your commitment to being part of this conversation by listening to the podcast as well as engaging in the FeelingBot application. Dr. Jackman is back with us this week to discuss mental and emotional well-being during the COVID-19 pandemic. Dr. Jackman is a Harvard-trained licensed psychologist with over 25 years in the mental health field. She currently serves as the Dean of Health and Wellness at the Boston Arts Academy, the only Boston public high school for visual and performing arts. Dr. Jackman is the founder and CEO of InnoPsych, Inc., an organization on a mission to change the face of therapy and to promote wellness and healing for people of color. InnoPsych, Inc. was awarded the 2019 Citizens Bank Small Business Community Champion Award for increasing access to therapy through its online Therapists of Color directory. As a change maker, Dr. Jackman is passionate about the intersection of psychology, mental health, diversity, equity, and inclusion, and has created social impact initiatives that support community members and mental health professionals. She's also the recipient of the 2020 American Psychological Association's PLC Diversity Award. Dr. Jackman loves talking about mental health and has been featured in both print and TV media outlets locally and nationally. So I'm excited to be hosting this conversation with Dr. Jackman today. So here's my first question for you, Dr. Jackman. We've seen the headlines noting this is an unprecedented time. Some have called this period the period of three pandemics, in fact. COVID-19, the spotlight on racial inequities, and the financial downturn in the US. One would also say that these stressful times are stressful times for mental health, and that could be considered even the fourth pandemic. So I'm wondering if you could share with us the ways in which stress affects our emotions.
Thank you, Mike. It's really exciting to be back with you today. So I just want to pick up on that thread. We are saying that mental health is the fourth pandemic. And the way that, I see how stress affects our emotions, I want to share a couple of things first. So when we think about stress, we often think about the negative aspects, right? Kind of that distress part. I just want to name that there's also good stress, and they call it eustress. And it's those positive feelings we have before a big event. So maybe like a first date or maybe a wedding. So there are things stress allows us to actually get motivation and do the things and execute on goals that we have. So we need a little bit of stress in our life. But when we often talk about stress in terms of those negative aspects and maybe the distress that we're experiencing as a result of COVID and the resulting sequelae from COVID, the disparities in healthcare and healthcare access, the racial reckoning that's been going on, those are definitely more negative aspects. And so how that impacts our emotions, what happens when we're stressed out? It often triggers a response in our bodies that activates us. So some people may get hyper aroused. There's this whole concept of our window of tolerance, and that's the area where we can cope with difficult things. When we are triggered and we are outside of that window of tolerance, we may be hyper aroused. That means we're activated, we might be in a fight or flight response. People may respond with anger, frustration, sadness, right? But we're activated and not able to manage the things that are before us. There's also another way that we respond. Some people respond, and that's a hypoarousal. And then that's where they're more vegetative. If we think about that flight, fight, freeze response, you think about people who may just start to sleep more often, not participate in the things, may not go to work, may not be able to engage in those daily tasks, take care of their kids, things like that. So those are ways that our bodies respond to stress. And I really talk to clients, and I said this last time, is that our minds and our bodies are really intricately connected. And one aspect and one thing that impacts our emotions plays out in our bodies. And our bodies are often the first sign of any distress that we're experiencing. And so that's why it's so important to be in touch with your body and understand what's going on for you.
That's really interesting to hear about the hyper and hypo. It makes a lot of sense, just having experienced stress over time. And it's good to know that there's also good stress as well.
Right. We forget about that one.
Yeah, who would have known? My next question is, how has mental health changed over the last year of the pandemic from your position?
Yeah, and I know HPHC is you're in a lot of the work that you do is in the mental health arena, but we know there's so much stigma around mental health and mental health care and accessing those care, particularly for communities of color. And so one of the things that I've seen and I've actually been happy about as someone who loves talking about mental health is that there are lots of conversations happening about mental health. And I think people are actually looking for those resources. And I would jokingly tell clients and people that I interacted with, is like, no one can judge you for wanting to go see a therapist now, just because of all the year that we've experienced and all, as we mentioned, just all the different consequences from COVID, right? So if this is a time you've always wanted to go now. No one can judge you for that. But I've really seen through my organization as well, the demand for therapists has significantly increased over the past year.
It makes sense. These are not easy times. How have communities of color been impacted differently from their white counterparts during the pandemic?
Yeah, so I mean, there are many ways in which we've seen this disparities impact communities of color. And we knew this, right? Going into COVID, we knew that disparities existed, but we've seen them in terms of our physical health, right? Who were the people who fell ill from COVID? There were clear disparities in that. Who have access now to the vaccines? In Massachusetts, there was a colleague share some data points recently who had access to vaccines. 71% white people did, and this was about 2 weeks ago. 7% in the Black community, 13% in Latinx and Hispanic communities, 7% in Asian communities. So we see very clear the disparities in access to healthcare. Also, who were the people who were financially impacted? Were people who often are in those essential jobs, which tend to be the lower paying jobs, which tend to also connect with people who are living in low income communities. So we saw that almost that triple threat of having that financial, the physical health, and then the mental health consequences. The other thing is that community, for many communities of color, Black communities, Latinx communities, Native, Asian, being with family and being in community is part of how we exist. And being cut off from community and your loved ones has been a significant stressor for people in communities of color. Not being able to access their faith base through going to church, right? Being in community, right? Being in live community has had significant impact. So being disconnected from community, again, just the isolation that people have experienced. And then for many people who've then experienced loss, the deaths of family members or friends due to COVID, and then not being able to mourn or gather in ways that are traditional to those, how you observe a loved one as well who's passed on. Just, and I could go on, but those are some of the main things that I've seen. So the grief and loss, being able to express that, the financial impact, access to physical health care, and then mental health care is also another major concern.
It's not surprising to hear about the effect isolation has on such oriented populations. It's really hard to not have those support mechanisms in place. So thank you for those points. Those are great. I'm wondering if you could leave us with one coping strategy that you think is important for all of us to keep in our own personal toolkits as we look to the future.
Yes, and as we connect back to the whole idea of the isolation, right, that people have experienced in mental health, isolation is one of the key things that we look for that social withdrawal, the isolation, when people are experiencing a mental health condition, it's something we really work to get them connected to someone else or another community. So I'd actually like to take a little liberty in giving two strategies, if that's okay.
Please.
One is creating a gratitude list. So one of the things that we've seen through research is that attention to gratitude has significantly positive impacts on someone's emotional well-being, reduces stress, increases happiness, increases satisfaction with life. And it seems really simple for people when they hear it, like what's gratitude? But it's really about appreciating, showing an appreciation for the things that you do have. And I think in a time of COVID and the pandemics, that being able to reflect on the things that you do have is really important. So an easy way that I do, and again, we talked about last time, was really building a practice, right? So a practice of gratitude, maybe starting and or ending your day thinking about 2 to 3 things that you're grateful for. It doesn't have to be a long, exhaustive list, but imagine starting your day thinking about the things that you're grateful for. That will reshift how you enter your day, right? You're not looking for the problems. You're not looking for things that you don't have. You're actually focusing on what you have. And the same way when you end your day, thinking about the things that you do have allows you to focus your attention on what you have in the present and not worry about the things you have to do or things you haven't done. So I really encourage that for people. And it's something that I do myself as well. And then the other thing in terms of thinking about the isolation piece is sending a note to someone or a text or picking up the phone, giving a call to someone you haven't talked to in a long time. As much as that brings joy to someone else, the feeling for yourself is just as intense and immense. Mm-hmm. So gratitude list and just, sending a love note, a care note to someone in your life, someone you may not have talked to, reached out to in a long time. So those are my 2 tips for today.
That's beautiful. That's great. Well, gratitude for others is certainly what I think you're conveying here. And so I'm going to express my gratitude for you today, for your expertise in coaching. This is terrific. I really appreciate it. And I'll look forward to future podcasts with you. So thank you very much, Dr. Jackman.
Thank you, Mike. It's a pleasure.